Now we have to learn the Norma Occipitalis. Let's see the bone stacking part. The occipital bone, the two parietal bones, and the mastoid process of the temporal bone, they are the part of the Norma Occipitalis. Now observe various sutures. This one is the sagittal suture in between the two parietal bones. Then observe the inverted V-shape lambdoid suture formed between the occipital bone and the two parietal bones, right? What else you observe here? You can see the most prominent protuberance called external occipital protuberance, and the highest point here is called as inea. And you can observe various lines bilaterally present. These are respectively the highest knuckle line, the superior knuckle line, and the inferior knuckle line. Now you can see that there lies the parietal foramen present on the adjacent side of the sagittal suture. Now you can observe the parietal eminences on the both sides of the parietal bones. Now see the bones that take part here. The green color bone is the parietal bone contributing the Norma Occipitalis. Now this is the temporal bone via mastoid process that also takes part here. And in this picture you can see that the occipital bone is being shown that takes part in the Norma Occipitalis, and also you can see the area of the meeting point of the sagittal and the lambdoid suture called as lambda. This is the place where the posterior fontanelle existed, right? And the highest point over the sagittal suture is called as vertex. Now what else you can observe? There are a few other sutures. Let me mark them. This one is the parieto-mastoid suture, right? Now we have to see what else is there. We can observe that there lies the occipitomastoid suture, right? Now again look at the sagittal suture present in between the parietal bones. Now concentrate on the lambdoid suture like inverted V present in between the respective bones, that is the occipital and the parietal bones. Now the Norma Verticalis, that is the view from the superior aspect of the skull. Here what you see, let me mark, this is the frontal bone, these are the parietal bone, and in between them you can see this is the sagittal suture, and this one is the coronal suture that allows the articulation of the frontal bone and the two parietal bones. What else you can find here? You can see that these are the prominences on the lateral aspect called as parietal eminences, right? And what else you find here? The parietal foramen located on the each side of the sagittal suture. Now this is the picture to show you that how parietal bones are present in the Norma Verticalis. Now look at the position of the coronal suture that starts from the one temporal fossa and up to the other temporal fossa, right? Now see the placement of the sagittal suture in between the two parietal bones. Now you can see that there lies the lambdoid suture that is present in between the occipital bone and the two parietal bone in an inverted V-shaped lateral, right? Now another view showing the color diagram to show you the various bones. And here the important thing is that the meeting point of the sagittal suture and coronal suture is called as bregma. This is the place of the anterior fontanelle. Now at the posterior aspect you find the meeting point of sagittal suture with the lambdoid suture. Here the point called as lambda, that is the place of posterior fontanelle. Now let me show you the highest point on the sagittal suture is called as vertex. Another very good color diagram to show you the frontal bone, the coronal suture, the bregma, the sagittal suture, the parietal bone, the lambda and the lambdoid suture and the occipital bone. Now we can see the interior surface of the cranial vault. So let's get started. This is where the number 4 is written. This is called as frontal crest. Then what else we can see? We find that on the frontal bone, we see various indentations or depression meant for the arachnoid granulations being marked by the number 2 you would see. Then you can see the coronal suture being marked by number 1. Then you can find the sagittal suture marked by number 9. And this 8 number is showing the parietal foramen. 6 number is showing you the grooves for the meningeal vessels like middle meningeal vessels, right? And number 8 is showing you the parietal foramen. So this is the interior of your vault, right? Now the norma lateralis. Now we have to see which bones take part in it and which features are present in this view. Now we have to learn which bones are there. This blue bone is the frontal bone and there is the coronal suture. Then this is the parietal bone. This is the lambdoid suture. This one is occipital bone with the external occipital protuberance. This is the temporal bone and squamous suture. We have to see this one is the sphenoidal bone. And if you get it from the anterior aspect, you find the nasal bone. And what else you see? This is the anterior nasal spine. And if you get entry into this orbit, you see this interior one is the lacrimal bone and this pink one is the ethmoidal bone. Now you can observe the zygomatic bone with the zygomatic arch. Now what else you see? You see the mastoid process, the styloid process and the external acoustic meatus. What else you find here? You can see that we have got temporal line which are anteriorly merged with each other but then they become visible. The superior temporal line fades away and the inferior temporal line continues as a supramastoid crest. Then it has to join the zygomatic arch. Now what else we see? We see here that there lies the mandible. This mandible is showing its body with the mental foramen. There is angle of it. Then it has got condylar process that makes a joint in the mandibular fossa, that is temporomandibular joint, right? Now you can see here what bone is also present. This is the maxilla. Now here you get the infraorbital foramen. In this picture, zygomatic arch is beautifully seen, formed by the zygomatic process of the squamous bone and a process coming from the zygomatic bone to complete it, right? And here in H-shape suture called as terion present in between the frontal bone, parietal, temporal and sphenoidal being marked by the yellow arrow. And here you can see that this point will internally address the middle meningeal vessel and its rupture may lead to epidural hematoma, right? Now you can see the lambdoid suture very clear in between the occipital and the parietal bone posteriorly. Now look at the squamous suture present between the temporal bone and the parietal bone. Again see how coronal suture like a crown present in the temporal fossa starting and running on the top of the skull. See the bones taking part in this norma, the zygomatic bone here. Now visualize the temporal bone that it is making the zygomatic arch. Its squamous part is there. The mastoid process and styloid process are also a part of temporal bone. Now see the sphenoid bone. Now look at the contribution of the frontal bone in the norma lateralis. Now the parietal bone, how it is taking part in this norma. Now this is the placement of the nasolacrimal duct along the lacrimal bone and is going to supposed to be opened into your nasal cavity. Now here you can observe the mandible, especially its ramus and the two processes, the condylar and the coronoid. Here you can see the zygomatic arch, and in the temporal fossa the temporalis muscle lies. Here the pterion point is marked and being encircled with the blue lines. Now a schematic representation of various important points. From the anterior aspect, you would observe the glabella, the median eminence, just below it at the root of the nasal bone, the nasoid point is there. Then you can visualize the pterion. Then you can see the bregma, the place where anterior fontanelle was there. Then the highest point is vertex, and then posteriorly you find the lambda over the lambdoid suture and asterion point as at the mastoid fontanelle. This is a junctional point where three sutures meet, and inion is the point on the external occipital protuberance. Here in this view you can see that there lies the styloid process that has to give attachment to various ligaments and muscles. This view is showing the presence of mastoid process marked by the red line. Here you can visualize the temporomandibular joint being formed by the mandible that has got the condylar process and articulate with the mandibular fossa, and you can also see the articular tubercle present on the zygomatic arch area. And what else you can see? You find that there lies the nasal bone and the anterior nasal spine is there. Now you can see this is the lacrimal bone in the orbit. You can clearly imagine where it lies. Now look how the maxilla bone is placed and forms the Norma Lateralis. Now you can see the nasal bone present at the pink color marked. You can visualize with the arrow. This is the mandible again to show you in the green color. See the occipital bone taking part in the Norma Lateralis. Few other important landmark on the Norma Lateralis. You can see that there lies the infratemporal crest, which is being marked by the blue line just opposite to the zygomatic arch on the medial aspect or lower edge of the temporal bone. You can see it very well. Now concentrate a little bit posteriorly that you find the inferior temporal line is continuing downward to form the supramastoid crest, and you can see the rounded area here, which is called as, you call them the suprameatal triangle, that is present postero-superior to the external acoustic meatus, right? Now in this picture again beautifully shown the supramastoid crest, and if you can see the temporal fossas there, and you find the superior temporal line and the which is also touching it posteriorly, but if I mark the inferior temporal line, that continues as supramastoid crest, right? Now you can see the pterion, the other features visible in this view, right? Now we have to learn the temporal fossa. For this we have to memorize its boundaries. Let me show you that you can observe the temporal lines superiorly, the zygomatic arch inferiorly, and what else you see? Anteriorly you see the contribution of the frontal bone, the zygomatic bone, and a little bit from the sphenoid bone. And what comes posteriorly? Posteriorly you can observe that the inferior temporal line is coming, and also the supramastoid crest is forming the posterior boundary. Now what about the floor? It's being formed by the four bones, the frontal the parietal, the temporal, and the sphenoid via its greater wing. And this is the same place where pterion is formed, right? We have to learn the content of the temporal fossa. First of all, temporalis muscle. Next comes the deep temporal nerve, a branch of mandibular division of the trigeminal nerve. Then you can see deep temporal arteries coming from the maxillary artery. Then you can observe the zygomatico-temporal branch of zygomatic nerve, which is also passing or is present in the temporal fossa. Now you can see the temporal branch of facial nerve lies also there. Then auricular temporal nerve is also the content. Now you can see the middle temporal artery, branch of superficial temporal artery, and it is coming from the external carotid arteries. These are the contents you observe in the temporal fossa.